So you as a nurse, how do you get along with a problematic CNA? Oh my God. Nurses and CNA, it's a never-ending story. It's a story that just keeps on giving. How do you cope with a problematic CNA? Okay, so how do you cope with a problematic CNA? What are you going to do? First of all, as a nurse, you need to know your job, because there's nothing as embarrassing as a nurse, whether you're an LPN, LVN, RN, it doesn't matter where you are as long as you're a nurse. If you don't know your job, there's not going to be any respect from the CNA for you, okay? You're the charge nurse, so there are a lot of things the CNA will bring to you. You need to know your scope of practice. You need to be able to own your role. You need to be able to own your position. Do not let a CNA roll over you. And CNAs will try it, especially if you're an LPN/LVN, because there are CNAs who think they are better than you. They're not. They're just haters. I've talked about that so many times in my videos. So I'm putting it up or just checking my library of videos, okay? Now, there are CNAs who are just problematic. You know, they don't want to do their job. They lie about getting their jobs done. And if you're not careful, they're going to lie on you. So CNAs like that, first of all, keep it professional always. Always professional, and make sure you document. So the CNA is not flipping the script on you and saying, oh, well, you know what, Nurse Amy picks on me. First of all, Nurse Amy doesn't have time to pick on you. You are a non-factor, okay, in the scheme of things. However, because we have to work together, we're going to try to make this work. And for us to make this work, you need to recognize I am the boss, okay? I am the supervisor. I am the charge nurse. So we need to get that out of the way. Everybody knows their duties. So you as the nurse, first of all, you got to know what you're supposed to do, okay? There is dignity and there's respect in you knowing what your scope of practice is. What do I mean by that? If a CNA that works with you has to be telling you how your job is done, okay, the respect is out the window. Boop, it's gone. Okay? Boop. If a CNA has to be telling you how to use a G-tube, if a CNA has to be telling you how to do trach care, if a CNA has to be telling you how to, let's see, what other things do nurses do? There's a whole lot of stuff, okay? A CNA is telling you, oh no, you can't do that, wound dressing like that. Or, first of all, you got to know your job. You just got to know your job. I don't care if you're a new nurse. Go on YouTube, go on Google, okay? Call another nurse, call a colleague in another state. I don't care, but don't be going to the CNA for tips, okay? That's one, because the CNA that's going to be problematic is going to air your dirty laundry. So I know some nurses struggle because there are some CNAs that are, because of the facility they're working, they're like larger than life. Nobody's talking to them. Some of them are actually good at their job, and that gets in their head because they think they cannot be fired anyway. You just know your position. Again, being professional helps. You can get the CNA, pull her aside. You don't need to talk to her in front of everyone. It's like, hey, look, it's like we're butting heads. And I've had to do this before. I remember going to this place where, now if you look at me, a lot of people think I'm younger than I am, which, well, you know, thank you, Jesus. But I'm a woman of a certain age. But a lot of people don't think that. So I do work with, and I have worked with people who are younger than I am, but they're bigger than me or they look older. I've also worked with older people who, well, whatever. People think that, oh, it's that little girl. That irks me. So sometimes I have to pull rank and let you know, hey, look, it's not even about size. It's not about age. It's about this office. I am the charge nurse, so I'm going to whip you into shape. The truth of the matter is I get along with my colleagues. I get along with my staff. I am that popular nurse. Why? Because I'm human. I don't micromanage my CNAs. I really don't. But that doesn't mean you shouldn't do your job. Does that make sense? I don't do disrespect. I don't do rude. Don't lie to me, okay? There's nothing new under the sun. If you couldn't do your job, let's find a way to make it happen and also protect you, right? But anyway, if you do have a problematic CNA, I mean, I've had some, And I do remember this particular instance. It was something to do with, I think it was giving water to, I can't remember what it was, but I was doing something. And so the patient came and said, oh, I need water. And I'm like, oh, go to your CNA. I can't do it right now unless you want to wait, and then I'll get you. So, but I think the patient left in a huff. Some patients are diva. And she went to the CNA. And the CNA came back like, wait, you could not, you... I'm laughing because we actually became good friends. And this is what happens. Some people are just stupid at first, and then later on they realize, I mean, whatever. I don't know why we have to go that way. But she came to me, you know, because again, I was a PRN there, and she see me like, who's this little girl? Okay, well, we'll see how little this girl is. And she came to me and she said, oh, I see you couldn't give her water. You could have just gone over there and given her water. So first of all, I'm charting because I needed to do something. So I looked up. I'm like, are you... I'm laughing because I totally remember now vividly. I looked up. I'm like, are you on medication? I'm like, are you on medication? And I think that kind of just, she didn't expect that from me. I'm like, are you on medication? And then she looked at me like, because clearly you have to be to talk to me that way. In case you haven't noticed, I'm the charge nurse, you know, and you could have come to me. I said something like that. Like, first of all, you don't even know what happened. But in case you haven't noticed, I'm the charge nurse. You need to go give that woman water. You know, like, I kind of now just pulled rank, you know, like, how dare you come to me asking me, I could have given her water. Where's that coming from? First of all, that's rude. It's not professional. And how dare you? You're a CNA. You're coming to me and telling me I should be doing your job. Now, don't get me wrong. Anybody can give water to a patient. Okay, do not get me wrong. I do it all the time. And that's why I get along with my colleagues, CNA or nurses, you know. But I was in the middle of actually doing something. I think I got an order. It was some new order I needed to get in or something, which a CNA usually cannot do. Okay. But then if you're not doing their job, for some CNAs, it just means that nurse isn't willing to help. So I remember this a long time ago. But later on, and I know then she went on and told other people, oh, that nurse is, and someone like, no, Nurse Amy, no, she doesn't. She's actually, when I worked with her, she's nice, da, 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 da. So, and I think someone heard and they were like, because she was a problematic CNA. Everybody knows her. She intimidates everybody. She's a big woman and she's like, I don't know. I don't want to use a derogatory word, but she was big and she thought no one could talk to her. Well, you know what? You messed with the right one because I did. Like, girl, we gonna bring you back to you. Anyway, some of you watching this now probably think, you know, I'm just a problem person. I'm not. I don't even have time. Seriously, I'm all about just doing my work. Anyway, and I'm like, go get her water right now. Because my turn was, and if you're not doing, I'm writing you up. Okay, do your job. So, but later on, and I think she will see me and she will feel some kind of way. And for some reason, they kept putting us together and like, go do this, go do that. And then I called her. I'm like, look, let me tell you this. I think we got off on the wrong foot, you know. I see that you feel uncomfortable. And I'm also, so we're coming to work like, okay, like we both don't like each other. And I'm like, we don't need to be that way. I'm nice. But I think it's the way you came at me. I was in the middle of doing some doctor's orders, but you came at me rude. And that's not acceptable, you know? You don't know me. I don't know you, but you could have come and asked me like, oh, so-and-so said she needed water. I didn't know, First of all, give her the water because you should. That the patient comes first. And you could have said, oh, you know what? Maybe it would have been nice if you helped. And it would have been nice if you helped, you know? And I would have explained myself why I couldn't. And the truth of the matter is, I could not at that moment. But I gave the patient the option to wait, but she didn't. She went to you. So sometimes you got to do that, and you find your rhythm, you know. And sometimes you got to do that with a problematic CNA. But what you will not do is play into their games or their politics, trying to bully you. Bully is not acceptable. And sometimes just be professional. Be professional, meaning that you're documenting. Meaning, you got to be wary of CNAs who are evil. Excuse me. I've worked with an evil CNA before, and they're evil. They will lie on you. They will lie on you just because they don't like you. They feel intimidated by you. They think that because bullies don't like you when you stand up to them. And there are CNAs who bully, but then there are nurses who bully. Okay, and that's the truth. So, how to get along with a problematic CNA, that's one of them. And again, not playing into the politics, but you can just be nice. Niceness sometimes wins people over. A lot of times they're just afraid, but what you don't want to do is show that you're afraid or have them dominate you. You cannot do that. You're the nurse. If you let them roll over you, you're done. Okay? You just need to be able this is my thing. When you're professional, it helps. Just be professional in what you do. Be pleasant, be polite, but you just let them know and have that talk. The talk really helps. Like, hey, look, it's like we're button heads. I don't know why we're doing this. Is there something that I'm doing that you don't like? Now, I can tell you it's not easy to do those things because sometimes you just want to pull rank, but sometimes it's just to talk to a person, and then they might tell you like, oh, well, I didn't mean to do that. Okay. Or, oh, is this how we're playing it? Then See, you got to know the rules of the game. Okay, then you know how you're going to play. But I can tell you right now, dealing with a problematic CNA, know your job. You got to know your job. If they're teaching you a job, okay, well, they're going to be telling on you. They're going to boss you. Okay. Be professional. Just be professional. Make sure you document. If they're not doing certain things, you got to let them know, hey, look, I need to do this. Don't play favoritism. Does that work? Maybe you might have another aide. Now, that might work for you. If she sees that you're being nice to one aide and you're not being, I don't know. It depends. You will get a feel for what works. Okay. So, but the thing is, talk to them, explain. There might be something they have in their mind, or you can just work together. Again, if it comes to that point, then you can't work together. You got to let the management know that, hey, we're not working together. What you don't want to do is be fighting or getting a shouting match. No. You are the boss. You are the supervisor. Act like a supervisor. You don't have to be his friend or her friend, but you're going to let her or him know you are the charge nurse. You're just going to be fair. Be fair across board to all of them, and the others are going to know. Eventually they're going to be like, girl, stop what you're doing, because a lot of times the problematic ones, they have a history of being that problematic. So again, hope you got value for this. If you did, give me a thumbs up. Yeah. If you haven't subscribed, please do so, and hit the notification bell so every time I come up with all those great videos, you're the first to know. You get an alert. Ding! So I'll see you in my next video.